Hello and welcome to today's episode of Health University, where today I have the good fortune of speaking with Dr. Robert Whitfield. Thank you for joining us, Dr. Robert. He brings, as a distinguished board-certified plastic surgeon, a background in microsurgery and oncology, and he spent years performing breast reconstruction procedures for cancer patients. However, after an experience with a patient whose cancer had gone unnoticed until Dr. Rob ran deeper tests to get to the bottom of her symptoms, he then shifted the way he practiced medicine to take a much deeper, more personalized approach to patient care. And he turned his focus to take a holistic approach to healing patients with breast implant illness. From how he evaluates his patients with complete genetic workup that allows him to create a completely individual treatment plan, to the way he performs the surgery called total capsulectomy, to his SHARP protocols, which I hope we'll hear more about, which supports the healing process from before the surgery is even performed. Dr. Whitfield understands the body and what it takes to support healing and recovery, and he is single-handedly redefining surgical patient care. I hope I got that all correct. And if there's anything that I missed, Dr. Rob, please let me know. But I'm really so grateful to have you here because this audience at Health University are fertility patients who might be considering IVF or trying to conceive naturally, and those for whom perhaps have had implants and or need to understand what is implant illness and whether to consider having explants. I'd love to hear your thoughts.
Absolutely. Thank you for having me. I appreciate this opportunity to speak to you and your audience. I'm sure this will be important for them. I've done several thousand explants. I've done many thousands of breast reconstructions. It was a breast cancer patient that we didn't miss the cancer, but we missed an infection. So that's the rub in this situation where a device, whether it's hip, knee, breast implant, dental implant, they can all harbor bacteria, virus, fungi, and that's been well documented since we could, basically look at things with microscopes. And so if you have a low-grade contaminant that forms enough colonies or like a little village of bacteria, if you will, that's a biofilm. And that's the stuff that biofilm, everybody knows what plaque is on your teeth. That's a biofilm. And it's those things that interact with our tissues to give and stimulate a more enhanced immune response. And that's what we're learning more and more about now.
And we want a sort of a balanced, calm immune system while a body is trying to conceive and while an embryo is trying to implant and a fetus is trying to grow, for sure. So what might a breast implant illness look like? What kind of signs and symptoms might appear?
I think the term you used, balance. So many times what I find is based on genetic testing and toxicity exposure. So each of us, you and I, have a set of genes that allow us to address whatever we get exposed to. If you apply something to your skin, I'm drinking coffee. My coffee may have mold in it, even though I drink mold-free coffee. The food we eat, the food we eat may have glyphosates. For everybody listening, glyphosate's a herbicide and or pesticide that gets sprayed on crops. And so we each get exposed to these things all the time. And our body has a certain amount of capability to detoxify those substances. Once we exceed that ability, our genetic ability, then we can have signs and symptoms of probably first acute inflammation. And then as time passes, it becomes chronic inflammation. And it's that imbalance that creates a problem for my patients. And there's usually a triggering event. I have a lot of patients that come to me from all over the country and Europe and Asia now, and they have problems with environmental exposures. They may be heavy metals. So a common environmental exposure, everybody's heard of lead. We can all remember them talking about Flint, Michigan, and how bad the water is with lead. So lead pipes were common in early construction. Obviously, they're not now. Lead paint was common. Asbestos in basements. I lived in a very old build, a 1930s build around Lake Michigan at one point, and every basement had asbestos in it. It was a common building material. So these are just examples of materials that can then lead to, obviously, a toxin exposure. And then in those basements or in those homes, whether they're in the South where I live or they're in the North, in the Dakotas, the weather extremes in this country create a lot of moisture issues in homes. The construction, I won't comment on it, but it can be problematic. And then you can get a mold not just if you want to say a buildup, like if you had a water leak or something where moisture was continually happening in your home, you would get potentially a exposure from black mold. So those are called mycotoxins. So that's another form of, and then the thing that I feel that I see in my patients, combination of factors that once they exceed their genetic capacity, then they become extremely symptomatic. And then I do see people who come specifically with fertility questions in mind. And many people, they may have genetic predisposition to MTHFR, which is a problem with methylation, which I was a microsurgeon for the better part of 20 years. I don't do that as a part of my career anymore. So I would take things that are as small as the coffee stirrer you get at the coffee shop and sew those together with suture that's finer than your hair under a microscope. And that would restore blood flow to the tissues that I was transferred from one place to another. So if someone was MTHFR positive, I would not do that procedure for them because even though they would say there's no rate in thrombosis in large blood vessels or blood clots in large blood vessels, I was operating on something that was only about 1.5 millimeters in diameter. So that coffee stirrer would easily clot, and then that would lead to a failure. So in those cases, we would prefer to go a different direction. Long and short is you only have a certain set of genes, you express them, that's your phenotype. Your toxin exposure plus your gut health and sensitivities and hormone balance and metabolomics all paint the picture of why you do what you do. And in patients trying to have or conceive, they need as much balance as possible. My patients come out of balance all the time.
We all do, right? We have our threshold, we exceed our threshold, and then there's a tipping point. Would you then say, or am I correct in thinking that then perhaps this breast implant illness is almost like an autoimmune response, like that person has tipped the threshold? If there's not a mycotoxin or infection in the implant itself, it can almost be like an autoimmune response to this thing that's in the body?
Yeah, I get asked that a fair amount. So autoimmune problems predate implants. So autoimmune problems, late 1800s, were known and described, and first implant for breast was placed 1962 by Cronin and Giroux. So people had those problems before implants ever found. And I will say the complexities of the immune system are still not well understood. Recently, there was a paper published by Mithun Sina, and he described an interaction of oxylipin tenhome, which is a byproduct of oleic acid, and its interaction between your tissue, the breast tissue, and the biofilm leads to more symptoms in patients. I think the story is just barely being written about this because of our inability to understand exactly what's going on at the cellular level, if you want to be critical. People will come to you and I and say, hey, I don't feel well, but all of my blood work's normal. Okay, how many times have you heard that?
Oh, daily.
So that's because the blood work hasn't changed since I've been alive, and I'll be 55 next week.
Happy birthday.
Yeah, and I tell people that all the time. They just look at me and I'm like, I mean, those are the same labs that people have been running since I was in med school. I graduated in 96. The thing that's changed is what? The genome project was completed, and now we know more about genomics. Now we have this whole advent of, I think functional medicine testing is great. I think the advent of mitochondrial testing and metabolomics testing. So metabolomics, for your audience, they're looking at end products of cellular metabolism, how much glutathione is being produced, how much palmitic acid is being produced, how much spermidine is being produced. So this is all important. And people ask all the time, do I have one test? Dr. Whitfield, do you have one test?
That was my next question. Are there tests for this?
Of course not.
Of course not.
All right. So if it was that easy, there wouldn't be any controversy, or there would be. We would just choose to do something differently with the story. So when people come, you've listened to people's stories for many years. So that's part of you being an excellent clinician, is listening, not discounting something, and remaining curious about, okay, what's going on here? And that curiosity leads you to advancements. Like when we are not curious anymore, then we should just stop doing what we're doing.
I agree. I agree. I would say that if I listen well enough, my patient will tell me exactly what's going on and exactly what I need to do. That's the Chinese medicine principles of diagnostics, is to look, feel, touch, take the pulse and look at the tongue and all of that. Yes. But then, so if we listen well enough, then we're going to get clues, but then how do you actually diagnose? And then how do you treat if someone has a breast implant illness?
Yeah, in the strictest definitions, because people ask me, like, what do I think this is? And so this is chronic inflammation,
Mhm.
of which a medical device is part of, which is the breast implant. And that's why, to be honest, Dr. Fox, when you have people explant and they don't do well, not my patients, because we do other things to address that, I get many direct messages. Y'all keep sending them. I want to help y'all who explant and don't do well somewhere else, because programmatically, they're not looking at why you have other reasons to have problems.
Mhm.
So it's not always a specific instance of the implant. It's not cause and effect.
It's not about removing it and then you just go skipping off in the daisies. Mhm.
That's the misleading part of this, and
Mhm.
that's not how we approach this at all. So for everybody listening, we have a very specific process.
The sharp protocol that you're about to share. Oh, good. Okay.
And our book's coming out shortly about the method really is born out of what I discussed. Like, you have to listen to everybody, and then now you have to set up some benchmark. And everybody asks me, is there one test? And there isn't. So I look at genetics, I look at current toxicity burden, gut health, food sensitivities, which are a big problem, hormone balance, and metabolomics. And that just helps create everybody who's listening who's old enough knows what a Polaroid is, or a Kodak moment. So that's really what it is.
Yes.
And in a world where everybody wants instantaneous gratification and information, that just doesn't happen in this situation. It's unfortunate, but you have a second basically now, or millisecond probably, to make an impression. And this is something that takes a fair amount of experience and understanding to get a good picture for you, and then put you on a journey of balancing out your detoxification, so that, just like Dr. Fox was mentioning, you can get your body, and it is about just getting balance back, because now you're out of balance. Whatever the triggering event was, whatever the tipping point was, you have to, whether it's your air, water, food, home, products, X, whatever it is, you have to
Mhm.
sort it out.
So am I correct in thinking about it that it's the onion layer, right? So you take care of as many things with one layer as you can, knowing full well that there will be layers beneath that then will then be able to be addressed better once you've healed a certain level of, say, methylation and detoxification pathways. Am I accurate that in thinking about it that way?
Yeah, I think the way I think about it is, if you get in your car and the music dial's turned up as loud as it'll go, that's your immune system in this situation, and we want to turn it back down. I'm never going to get it back down to zero. That's not going to happen. But
Mhm.
if we can get it down to a level where you can function better, your activities, you can go out and play with your kids.
You can get pregnant and have a healthy pregnancy and healthy postpartum.
Yeah, because that's balance. I firmly believe that outside of antiphospholipid antibody, which was basically found out when I was in med school in
Mhm.
95 or 6, I can't remember, these kind of genetic predispositions are certainly playing a role, in combination with diet and environmental exposures. It just, it makes, maybe that's the problem. It just makes too much sense.
Yeah, I also would suggest that it could be a problem because then the onus is not a pill. There isn't a magic anything that will say, okay, now I can just go back to my life as it has been, which was
Uh,
part of creating the problem. So because there is a teamwork that has to take place, right? So you offer your treatments, but then the person receiving the treatments needs to make some lifestyle changes in order for those treatments to actually have an effect and stay in effect. You mentioned that it's not overnight. Can you speak to a little bit, like, how long does it take? Is it 30, 60, 90 days? We think on our side of fertility of the 90 to 120 days of folliculogenesis. What might that person want to consider time-wise before they say, okay, now this is a good time frame to do the healing so that I can then try to conceive, but be it naturally or through IVF?
Yeah, I think if you start with a really bad tox test and really poor genetic predisposition, you're in a whole different bucket. So those are my worst cases. Those people will take months to completely get back in balance.
Mhm.
And so it will vary. And depending on how you start, dictates on when that makes sense for you. I've had some folks opt to conceive relatively early afterwards. And that's everybody's, obviously, that's their personal decision, just like it is the explant. I don't decide explant for anybody. They've already made that decision when they come to me. I think there's a little bit of confusion about I'm some person who waves a wand and says, hey, you're the one who needs an explant. Everybody listening, I don't do that. You have to figure that out before you ever show up to see someone like me. I'm not going to tell you that you need anything. I'm going to just give you the nuts and bolts of this is a program that will help you continue to get better balance. This is a surgical recovery program. This is a supplementation program. And then we're working with folks on the neural program because mindset is such a huge underestimated component of this.
Amen. That is a big part of my coursework as well. Of course, it makes sense in the Chinese medicine model, but I think that it is sorely overlooked. And we've got raw coaches, which is great. But if that mindset of the individual can't shift, then that person doesn't have agency to make informed decisions. I presume SHARP is an acronym for, do you mind breaking down those 5 letters for us?
So we named it in a way that doesn't actually represent testing protocol or surgical protocol. It's strategic, holistic, accelerated recovery program. And basically, I think you can do a lot of things that each of us knows are very holistic. Modify your diet, improve your sleep, improve your air quality, improve your fluid intake qualities. These are all like behavioral things. So those are all holistic. I want everybody to do those things so that their recovery is as efficient as possible. And the things that we do in office strategically are we understand your genetics and how you detoxify. We look at all of your tox burden and create a detox program for you. And then pre-op, we help get people prepared for surgery by making those behavior and diet and sleep modifications, proper supplementation. We have very specific protocols prior to surgery to reduce nerve pain, nausea, swelling, inflammation. We do all sorts of specific nerve block techniques with local anesthetic in the operating room when we're operating so that my patients don't wake up in a lot of discomfort and they're not in a lot of situations where people are very sensitive. So you don't want your anesthesia team giving them a bunch of narcotics, which ours doesn't. And then the day after surgery, they're coming here for hyperbaric oxygen therapy in our office, red light therapy, and lymphatic massage. We have a great device from New Zealand called a Flopresso. And you do that and you rinse and repeat with a good diet, sleep, and proper supplementation. And that gives people the best chance to quickly get back to doing their activities of daily living. You can use that. And I want the book to be used for all types of surgery, not just what I'm doing, because it's more of programming so that I think, and obviously 99% of my clients are women, if not 99.9%. And their goal is always to get back to take care of their families, loved ones, work, all the above. Very complex, and they tend to just push through things. They don't really take time for themselves. Just so everybody listening understands, I'm pretty rigid now. If you want to engage and do something with me specifically, you start the program, you get on our supplementation, you make the diet and sleep and fluid and air quality modifications. You're running typically a certain amount of detox before you ever see me because I'm booked out several months in advance. By the time you get here, you're much better prepared overall for surgery. And I know people are probably listening going, oh, how's that really work? I've been operating in over 26 years. I'm pretty clear about what I want and understand what will benefit you. And then when you're here, you're going to stay here 7 to 10 days. If you're a continental United States patient, if you're long haul, it's longer. If you're from Europe or Asia or South America, like many of my clients are now, they're staying 2 to 3 to 4 weeks. And so if you aren't committed to that kind of engagement for a number of reasons, then you're not going to come see me. It's just not going to be the situation that's best for you. Many people, our country is enormous and it creates a lot of access problems. Once you get away from me, your access to the right, we'll even say food and or therapies, hyperbaric and red light and lymphatic massage gets severely limited. And people want to know how to recover quickest, right? That's, I know how to do that.
Yeah, quickest and most efficient and effective. because quick is quick, but the result is what you want. And so what I'm hearing you say is just ethically, you know what it will take, and you will not compromise your ability to do what it will take for your patients and then send them off into the Netherlands, hoping that they do well. Good luck with all of that. I did hear you say, and respect highly, that you would not make it the decision for a person about whether or not an explant is the right first move before the right next move before trying to conceive. But would you give some, or could you give some ideas of parameters around, if you're feeling this way, or if you're seeing these signs, then think about an explant before you go into, especially through IVF, because that's a very rigorous process. And many are, of my patients and who are listening in the audience are prepping for IVFs. With that being said, please give us your thoughts. Thank you for listening to this episode of Health University. We always strive to find ways to improve our support of you. Please connect with us for a fertility assessment call at the link below, healthuniversity.co, note not .com, /your-fertile-health-call. We'd love to learn a bit about you and share our resources. Now, let's resume our conversation in today's episode.
So that's where I have the most experience, is people either prepping or failing.
Yes.
And they found something or heard something that I've said or done on another show or in one of the videos I've made or my podcast. And that kind of situation. So if I just look at what will affect something simple like clotting or blood flow or what have you, had, as we mentioned previously, about 40%, maybe even higher, of the population has MTHFR. And okay, so that's one strike. My patients typically have 3 or 4 strikes. So it would be an interesting thing if I could tell you, of the fertility failures, how many people had that problem. It would probably represent a fair number of them. So if you take my 30% who have biofilm already on examination post-op, I don't know that pre-op, that just stacks a deck against you if you already have a genetic predisposition that's poor for detoxification. And we didn't talk about estrogen toxicity. There's a lot of problems in my patient population with estrogen toxicity and really high levels of estrone. That just the PCOS group and the endometriosis group, I don't know how much more challenged they are in terms of fertility, I'd have to say.
Yeah. Oh, for sure. Without a doubt. I can say so. Yes, they're very challenged with fertility, and they're often just ushered right into IVF. And personally, I'm a proponent of IVF as needed, but my goal for patients is to have one cycle, not 3 retrieval cycles, in order to create enough healthy embryos for bringing home baby. But I think this habit, if you will, and I do think it's just become almost like a bad habit of just rushing into a retrieval cycle with the presumption that everything's going to be a-okay, and then having to go through two retrieval cycles, 3 retrieval cycles, failed transfers. I think if we could get the message to people ahead of time that with a little bit of investigation and maybe a little bit more prep, you can reduce that to 1, maybe 2, depending upon if there's diminished ovarian reserve or something like that.
So basically, Dr. Fox just laid out my program. My program is, my program preps. It identifies your genetic predisposition and looks at your hormonal balance. And I put a lot of stock in gut health and food sensitivities because there's so many problems with the food supply. So if you're listening to this and you think I'm full of it, that's fine. I would say overall, everything you put in your body, the Olympics are going on right now. Last night was the 100-meter men's final, and it was won by 0.005 of a second by an American. 0.005 of a second. Performance, in this case, is to get a safe pregnancy, and you want to do everything you can to minimize the factors that would affect that. And if they're pro-inflammatory factors, then you take them out. You get a really high quality air filter. You make sure your water doesn't have heavy metals.
Poisons, bacteria, medications, all of the poisons.
Don't drink out of a plastic bottle, for goodness sake. Plastic bottles have phthalates in them. That's a plasticizer. So that really affects a woman's endocrine system. So don't drink out of plastic ever. Don't heat up your food in plastic. Really control is, to the best of your ability, the quality of the food you're putting in. If your performance is dictated by the air quality, fluid quality, and food quality, and then the other thing is if you're putting a product on your skin and you don't know what's in it,
Mhm.
then you better put it through the environmental working group and know what's in it. And if it's not safe or it's indeterminate, or certainly if it's bad, then don't put it on. And probably just these things alone will help get you into a better situation. Now, if you have breast implants, your inflammatory burden is going to be higher, especially if you don't detox well or you have just a estrogen toxic kind of situation. That's almost like a given in my head now.
Mhm.
So those are things that you could do right now that would help you from a fertility perspective.
Excellent. And if I could add just one thing, food, drink, environment, but also what we put on our bodies, but also our supplements. It's a wild west out there in supplement land. And so often people are getting their supplements through influencers or through Amazon. And really, the quality of your supplements is as important as the quality of your foods. You need it to be available. You need it to be resourced from high quality raw material. So consider before you go out there and buy something that might feel like a savings, the cost that it actually is to your body by the time you swallow that supplement.
Yeah, I think you mentioned that, and I tend to like, I didn't mean to gloss over it. So when people run our program, I have them pause their supplements for that reason, because number one, I don't know the quality of them, to your point, and I don't care. I know the quality of ours, and
Mhm.
I know they're bioavailable because they're liposomal predominantly. We made that switch several years ago because of so many gut health issues in our patient populations. For everybody listening, liposomal, basically it's going to be absorbed as it hits the oral cavity. It's just a spray. And the excuses made about unable to swallow pills and the frequency and all that go away because those are just excuses.
And they're excuses, but they may in fact be a real experience for someone who is having digestive imperfections, shall we say. They can't digest something that is a capsule or a tablet because their digestion is all a mess. But when we can get it just right through the mucosa to the bloodstream, then all the better. Or if it is a high quality capsule that we know has been double blind, placebo controlled, studied, and what's on the bottle is what's in the capsule is what is bioavailable, then you're not going to suffer that sort of ill digestive effect of taking the supplement. I feel as though we could just go on forever with this because it is such an important topic, but I want to be respectful of your time. And I also want to make sure that you have a chance, if there's anything we didn't cover here in this conversation, that you have a chance to share now. And listeners, all of this will be, in show notes, and Dr. Whitfield's resources will be available in show notes as well.
Yeah, I think echoing what you said about the quality and adding that with the supplements, the only other thing that I don't hear a lot of is the fertility practitioners or practices, whatever the best term is, they don't seemingly do a lot of genetic testing. I don't know why. I feel like that's a really hidden opportunity to help the patients who need to be maybe prepped better for success or who have experienced failure and don't know why. And they're constantly blaming themselves and all the things that go along with that when it has not so much to do with that, but these other factors that you can actually, when looked at closely, the book Atomic Habits is great. So it's just about making little changes in order to get a bigger result. So if the end game is a safe pregnancy, delivery, and everything, like what are the small steps, the supplement quality, like Dr. Fox mentioned, air quality, food quality, fluid quality, product quality that goes on your skin, really making sure your home environment's optimized. And then like I said, I look at everybody's genetics for a reason. Like
Mhm. Mhm.
if you
I
don't
think I
know
think I
that,
can answer a little bit that I see in the field that there is a presumption that if one is taking a methylated folic acid or an MTHFR friendly folic acid, it's one and done. So it's almost like take your 2000 IUs of vitamin D, we're not even going to test. Take your prenatal vitamin that has methylated folic acid, we're not going to test. And so it's almost this presumption that that's all wrapped up. But I'm hearing you say there's a much deeper dive than methylated folic acid.
yeah, goodness gracious,
Yeah, yeah, yeah,
that concept is older than I am.
yeah, yeah. Then there you have it. I guess I've set us up for our next conversation at Health University, where we can then go into genetics. And I would love to invite you back at some point if that's something that's of interest to you.
Oh, yeah. Yeah, of
Great.
course.
Thank you very much for your time. I really know that this has been invaluable to the listening audience. And as I said, audience, when you listen to this, take a look at the show notes, go over to look at Dr. Whitfield's website and the SHARP protocols and all of that. And if you have implants, consider all of what's been discussed and share with your friends, because this is something that I think is also the missing link in the whole fertility conversation, is that we hear something, we attend to it ourselves, but we're not sharing this information. And because 1 in 5 people are struggling with infertility, and I challenge that word, I call it subfertility, we need to get this information out. I think we can reverse this trend quickly. So thank you for listening. Thank you for being on the show, Dr. Whitfield, and I really look forward to our next conversation.
Thank you for having me.